After a long delay, Texas gave us a new look into the state's challenge with pregnancy-related deaths. The new data comes from the Maternal Mortality and Morbidity Review. The report shows the numbers have not improved when it comes to Texas women dying due to complications tied to pregnancy or childbirth. And the data shows Black women are affected at higher rates. And as our Ryan Chandler shows us, the report has lawmakers and activists calling for change in this upcoming legislative session.
2016, I had my son, and both he and I were at jeopardy of dying during my birth.
Facing death to give new life. Nikenia Wilson's near-fatal birth gave her a son and a mission.
I've just been working ever since to make sure that other women don't have to have that same experience or worse.
For State Representative Sean Thierry,
I nearly lost my life in childbirth from receiving a high-block epidural.
The latest data on death rates for pregnant Texans are a painful reminder, but not a surprise.
When that first report came across my desk and I read that Black women were dying at 3 times the rate, that I finally had the courage to say what happened to me.
The report found nearly 12 women died in connection to their pregnancy every month in 2019, leaving nearly 300 children without their mother. The danger doubled for Black women.
You can call it discrimination. I would go as far as to say racism.
They're more than 3 times more likely to face preeclampsia, the same pregnancy-related high blood pressure that almost killed Wilson.
I have a master's degree, solidly middle class. I went to every doctor's appointment, and yet, honestly, care that I should have gotten that just didn't happen.
The report breathing new life into demands in the Texas House.
I have an obligation to do this work because I survived.
Thierry's calling on the legislature to extend Texas's postpartum Medicaid benefits from 6 months after birth to 12. She also wants to require more timely data from state health services and to counter discrimination among doctors.
We can no longer be a footnote in these reports. Black women are the report.
Wilson also working to deliver change in the delivery room.
We have to believe that every mom's life matters, and we have to work to solve it as if our own lives depended on it.
Ryan Chandler joins us now. The conversation around this issue definitely changed after the 2021 legislative session. How do these activists and lawmakers think that the issue will change under Texas's ban on abortion, Ryan?
That changes the entire context around this issue, right? Nikenia, who we just heard from, said that she remains cautiously optimistic, but she said it is almost inevitable that with more mothers giving birth, there could very well be more deaths. So that's why they are pushing not just for expanding access to Medicaid coverage, but implementing legislation that could improve bias training within hospitals, improve that data reporting to try and tackle this issue from a lot of different angles now that it is so much more urgent this year.
All right, Ryan Chandler, thank you for your reporting. Our investigators have detailed problems with how the state tracks maternal deaths and near deaths since 2019. You can scan the QR code on your screen to see those reports now. You can find links to hear from Texas moms affected and look at the legislation which could make a difference. Thank you again for joining us for State of Texas. I'm Monica Madden. We'll be back next week to bring you an in-depth look at Texas politics.